the dollars coming out of your pocket keep going up, okay? I've been in this space for 6 years now, and this article made me, like, take a step back, and I was like, "Really? Interesting. Hmm. Anyway, the article comes from theconversation.com. It states taxpayers spend 22% more per patient to support Medicare Advantage, the private alternative to Medicare that promised to cost less. Hello, YouTube. I am back yet again. It is me, your girl, broker Evan Pollard, licensed in life, health, accident, sickness, all that good stuff. Anyway, you guys should know by now if you haven't known, or if you don't know. I mean, I'm pretty small, I'm pretty new here. So, pretty much all of you are going to be new. I'm the new kid on the block. Anyway, I'm just going to get right to it. Now, this article came up from theconversation.com, and I was like, I'm intrigued. I want to read about it. And when I started reading about it, I was like, here's some information that I didn't really consider before. Medicare Advantage not being as cost effective doesn't necessarily surprise me, mainly because we are, again, dealing with private insurance companies who are for profit. Everything in this country is for profit because why else would anybody be doing anything if they weren't getting a profit for it? Everyone has to make a way of life and a way of living, and I understand that, but coming at the expense of the taxpayers because this is a government funded program, it does raise question marks, okay? As I mentioned, this comes from theconversation.com, in which it states taxpayers spend 22% more per patient to support Medicare Advantage, the private alternative to Medicare that promised to cost less. I'm not going to bore you guys too much with the entire article, but I did want to just highlight some of the important things that I wanted to share with you. Just as a quick breakdown for the first paragraph, it states Medicare Advantage, the commercial alternative to traditional Medicare, is drawing down federal health care funds, costing taxpayers an extra 22% per enrollee to the tune of $83 billion a year. As a quick overview, Medicare Advantage, also known as Part C, was supposed to save the government money. The competition among private insurance companies and with traditional Medicare to manage patient care was meant to give insurance companies an incentive to find efficiencies. Instead, the program's payment rules overpay insurance companies on the taxpayers' dime. And as you see right above my head, it has Grace and Aaron. So Grace McCormack and Aaron Duffy are the authors of this article here. Researchers have found that the overpayment to Medicare Advantage companies, which has grown over time, was intentionally or not baked into the Medicare Advantage payment system. Medicare Advantage plans are paid more for enrolling people who seem sicker because these people typically use more care and so would be more expensive to cover in traditional Medicare. However, differences in how people's illnesses are recorded by Medicare Advantage plans causes enrollees to seem sicker and costlier on paper than they are in real life. This issue, alongside other adjustments to payments, leads to overpayment with taxpayer dollars to insurance companies. Some of this extra money is spent to lower cost sharing, lower prescription drug premiums, and increase supplemental benefits. For every extra dollar that taxpayers pay to Medicare Advantage companies, only roughly 50 to 60 cents goes to beneficiaries in the form of lower premiums or extra benefits. As Medicare Advantage becomes increasingly expensive, the Medicare program continues to face funding challenges. In the view of the authors, in order for Medicare to survive long term, Medicare Advantage reform is needed. The way the government pays the private insurers who administer Medicare Advantage plans, which may seem like a black box, is key to why the government overpays Medicare Advantage plans relative to traditional Medicare. But I do want to touch again on the main points that I wanted to share with you guys that I also found intriguing myself. So let me go ahead and get into this information for you guys. Essentially, there were two policy goals in 2010 when the Affordable Care Act came into place. It was designed to encourage private plans to offer the same or better coverage than traditional Medicare at equal or lesser cost, and to make sure beneficiaries would have multiple Medicare Advantage plans to choose from. The system was also designed to be profitable enough for insurers to entice them to offer multiple plans throughout the country. This is one of the important pieces that I wanted to kind of touch on. To accomplish this, Medicare established benchmark estimates for each county. This benchmark calculation begins with an estimate of what the government administered traditional Medicare plan would spend on the average county resident. This value is adjusted based on several factors, including enrollee location and plan quality ratings, to give each plan its own benchmark. Medicare Advantage plans then submit bids or estimates of what they expect their plans to spend on the average county enrollee. If a plan's spending estimate is above the benchmark, enrollees pay the difference as a Part C premium. Most plan spending estimates are below the benchmark, however, meaning they project that the plans will provide coverage that is equivalent to traditional Medicare at a lower cost than the benchmark. These plans don't charge a patient's Part C premium. Finally, in a process known as risk adjustment, Medicare payments to Medicare Advantage health plans are adjusted based on the health of their enrollees. The plans are paid more for enrollees who seem sicker. Now we're starting to see where the title is coming from. Theory versus reality. In reality, the risk-adjusted benchmark estimates are far above traditional Medicare costs. This causes Medicare, really taxpayers, to spend more for each person who is enrolled in Medicare Advantage than if that person had enrolled in traditional Medicare. It states, why are payment estimates so high? There are two main culprits: benchmark modifications designed to encourage Medicare Advantage plan availability, and risk adjustments that overestimate how sick Medicare Advantage enrollees are. Moving on to information about benchmark modifications. In 2012, as part of the Affordable Care Act, Medicare Advantage benchmark estimates received another layer: quartile adjustments. These made the benchmark estimates and therefore payments to Medicare Advantage companies higher in areas with low traditional Medicare spending and lower in areas with high traditional Medicare spending. This benchmark adjustment was meant to encourage more equitable access to Medicare Advantage options. In that same year, Medicare Advantage plans started receiving quality bonus payments, with plans that have higher star ratings based on quality factors such as enrollee health outcomes and care for chronic conditions receiving higher bonuses. This means that a Medicare Advantage plan spending estimate could be below the benchmark, and the plan would still get paid more for its enrollees than it would have cost the government to cover those same enrollees in traditional Medicare. Overestimating enrollee sickness. The second major source of overpayment is health risk adjustment, which tends to overestimate how sick Medicare Advantage enrollees are. No, that HRA, that sounds pretty familiar. Pretty familiar. But there is a critical bias baked into risk adjustment. Medicare Advantage companies know that they're paid more if their enrollees seem more sick, so they diligently make sure each enrollee has as many diagnoses recorded as possible. In traditional Medicare, most providers are not paid more for recording diagnoses. Policy experts refer to this phenomenon as a difference in coding intensity between Medicare Advantage and traditional Medicare. There is one part of the section where the money goes that I did want to go over with you, just because I found that it kind of ties into the title of the article in stating that it is costing the taxpayer a little more per year. It states the system sets up Medicare Advantage plans to not only be overpaid, but also be increasingly popular, all on the taxpayer's dime. Plans heavily advertise to prospective enrollees who, once enrolled in Medicare Advantage, will likely have difficulty switching into traditional Medicare, even if they decide the extra benefits are not worth the prior authorization hassles and the limited provider networks. Now, the two authors did propose where do we go from here at the end of the article, just to sum it up. But ultimately, as a whole, when it comes to the health insurance industry, and we're talking about healthcare that is given and received and the cost of the healthcare, there's a lot of debate that goes on about how much things can cost, should cost, and who is paying. To me personally, there are a lot of back and forths that can be going on as far as the private insurance companies and how much they are willing to pay, or how they are trying to extract more profit from the government or the taxpayers or whoever it may be, wherever they can get their money from. It's just really interesting information that on paper, Medicare Advantage enrollees are ought to seem sicker than they actually are in reality in order for these companies to get a higher payment. I still believe that traditional Medicare is a good option and a good way to go, especially if you are looking to add that on with a Medicare supplement plan to fill the gap. As you know, it is considered also a Medigap plan, which is a nickname for the Medicare supplements. And again, with a Medigap plan, you have more freedoms. With a Medicare Advantage plan, it is more coordinated care. But at the end of the day, it is up to the Medicare beneficiary what route they would like to go. I'm not making any recommendations for anybody right now because I don't know you. I don't know your needs. I don't want to say one thing may be better than the other or the other is better than this, but you do have your options when it comes to traditional Medicare and going with a Medicare supplement to fill in the 30% that you would be responsible for. And then you also have the Medicare Advantage on the other side. You can give me a call so we can discuss those needs so that we can place you in the right area or even explore both areas to see which one would be best for you and your needs and your lifestyle. It is just my job to make sure that I am here to educate you, steer you in the right direction. I am also here to ensure that you know exactly what you are signing up for, the benefits that you are to receive, and the benefits that are going to be available to you depending on what route you choose to go. Just give me a call at that phone number still listed on my Plan Enroll. Utilize that Plan Enroll to create an account, put in your prescriptions, doctors, pharmacies, and anything else that you may need for me to help you out. We'll figure that out for you and your needs specifically, especially because this is important. This is your health care. Medicare is what you're going to have for the rest of your lifetime. And I want to make sure that you avoid all fees that may be coming your way if you choose not to get Medicare, and also ensuring that you have the coverage that fits you. So again, give me a call. I'm here to work with you. No cost to you. My services are for you. And if you enjoyed this video today, please give it a like, comment, share if you care, and subscribe to my channel for more videos. Again, my name is Broker Evan Pollard, licensed in life, health, accident, and sickness, and I will see you guys in the next one.